Hello everyone, my name is Joaquin Castruita. This presentation is on the opioid epidemic in Nevada and the United States. The first question that we have to address is, what is the opioid epidemic? The United States is currently trying to discover strategies to deal with the rising of opioid overdoses and reported abuse. To further expand on how opioids have affected the United States, we have here that according to the CDC's December 30th, 2016 Morbidity and Mortality Weekly Report, or MMWR, drug overdoses have nearly tripled from 1999 to 2014. The CDC's MMWR also discovered that 60.9%, or 28,647 out of 47,055 deaths, were caused by an opioid overdose. Also listed on the Department of Health and Human Services website is that opioid overdoses have accounted for 42,000 deaths in 2016. Here we have a visual provided by the Department of Health and Human Services website that shows how the opioid epidemic is affecting the United States. For example, it shows here that 130 plus people died every day from opioid-related drug overdoses in 2017. In total, 47,600 people died from overdosing on opioids. This is an astounding number, and a number that can only be combated through certain measures that have also been provided by the DHHS. What is AB 474, or Assembly Bill 474? Some would believe that AB 474 was passed to get physicians to talk to their patients more and communicate more with them. However, according to the Nevada Rural Hospitals Partners website, it states there that this bill aims to reduce the number of overdose deaths in Nevada by requiring prescribers to perform more rigorous and reoccurring assessments when prescribing opioids. The next topic that we are moving on to are the pros and cons of AB 474. Now, there are many pros and cons to the bill AB 474, however, we are going to talk about two of them specifically right now. In Messerly's article, Monroy, a governor's healthcare policy analyst, stated, "The goal of the law," she said, "is to make sure doctors are having ongoing conversations with their patients." Now, this pro is important because the communication between doctor and patient is vital. It is very vital in order for them to ease into this bill. Now, a con to AB 474 would be a comment that was made in Becker's article by Dan Layard, a pain management specialist at Flamingo's pain specialist and a Las Vegas attorney. He said that he has a stack of referrals from primary care doctors received over the past 2 days sitting on his fax machine. It will provide further disincentives to take care of chronic care patients. Now, this con is kind of frightening because if you are a chronic care patient, it is tough for you to trust your healthcare service, thinking that maybe because of this AB 474, you may not get the care that you really need. Lastly, we will cover stakeholders and AB 474. Now, there are many stakeholders that were affected by the passing of AB 474. Specifically, patients were hit heavily by this. In Becker's article, Marks, a physician who has been practicing for 25 years, stated, "We are already seeing patients who are being referred to us or self-referred to us and complain their doctors don't want to write a prescription." That's going to be a real issue. Marks also stated in Becker's article that, "I think we are going to see more complications, more overdoses as a result of patients flocking to illicit, non-standard, non-quality type products." This is a negative impact on patients as a stakeholder. Additional stakeholders that were affected are described in Messerly's article, where Brian Sandoval stated, "For this reason, last summer, I convened a statewide prescription drug summit with participation from 500 stakeholders that included legislators, healthcare professionals, law enforcement, judges, and victims." This shows right here that AB 474 needed cooperation from all of its stakeholders in order to successfully pass and to be implemented. Another instance or another example would be how The State Medical Association pushed back on a proposal for mandatory urine drug screenings in favor of allowing providers to request drug screenings when necessary. They also advocated for making an initial prescription be as long as 14 days, not limited to 7. That there shows that healthcare providers do not have a real issue with the passage of the law, and instead they actually want to improve it. Listed here are the references that I used in my PowerPoint. I want to thank everybody for watching it. Also, if you have any questions, please email me at castrj6@unlv.nevada.edu. Thank you.